Yesterday, little Robbie Hughes was pushed out into a bright, loud, and unfamiliar world. As his mother Emily labored to give birth to her son, mother and child were enacting the final chapter of a story that had begun 9 months before, the creation of life. As we watch their story unfold, we'll witness the dynamic process that transformed a one-celled being into the 7-pound infant he is on this, his birthday. This is a story as old as the human species. It's a story of mystery and wonder that's played out millions of times each year, the unique story of how a baby grows. Their unborn child, the new family member who is as yet a stranger. Yet as it grows and takes form within its mother's womb, it binds the new family together. During the 266 days that usually pass from conception to birth, mother and child will travel a road of change and development that prepares the infant to go from his sheltered home to the outside world. This time between conception and birth is divided into 3 segments called trimesters, each about 3 months long. Each month of each trimester has its own story to tell, about how the baby develops and the ways the mother's body changes and adapts to support her baby's growth. Our story begins inside the mother's body. The fertilized egg spends its first few days traveling through the fallopian tube, journeying to its new home, the uterus. Then, about 6 days after fertilization, the tiny clump of cells implants in the uterine lining. Here, it begins laying the foundation for its future growth. As the embryo develops, the mother's body begins its long process of adaptation and change. While the early days of her pregnancy went undetected, now the revolutionary changes within her begin sending out subtle signals. As the days pass, hormones from the growing embryo alert the corpus luteum to prevent menstruation. When the menstrual period becomes overdue, the mother may start to suspect she's pregnant. During the rest of the month, the clump of cells changes from a 2-layered disc into a bean-shaped embryo. At the end of the 4 weeks, it looks like this. Within its primitive structure, the circulatory and nervous systems are beginning to form. A simple heart beats, and an odd bubble-like organ, the yolk sac, appears. This will soon produce blood cells and eventually form part of the baby's digestive system. By now, the mother's period is 2 weeks overdue. She may feel the first noticeable changes associated with pregnancy: tender, swollen breasts, fatigue, and a sensation of pressure in the lower abdomen caused by increased blood flow around the uterus. As the tiny embryo continues to grow within its mother, the eyes begin to develop, the hands start to form, and tiny projections called buds indicate the future legs. It's around this time that some women begin experiencing the nausea commonly known as morning sickness. This, along with an increased need to urinate, will send most women to the doctor to confirm what they already suspect, their pregnancy.
That day, my doctor told me what I was already pretty sure about. I was going to have a baby. We figured out my projected due date based on when I had had my last period. She explained that these dates aren't an exact science. I could give birth anywhere from 2 weeks before to 2 weeks after this date and still be considered right on time. We went over my medical history, paying special attention to any health problems, like diabetes, that might complicate my pregnancy. I was in good health, so we didn't have any concerns there. Then we spoke about setting up a schedule of appointments. For the next 6 months, if everything went well, I'd be going once a month, then twice a month till the 9th month. During the last month, doctors like to see you every week. During the first appointment, I had some blood tests. and an internal exam. Then we went through the basic kind of checkup I'd have all during my pregnancy. My abdomen was checked. My urine was checked for sugar and other trouble signals. My blood pressure was taken, and I was weighed. And the doctor examined my hands and legs for signs of swelling. In the later months of pregnancy, this could mean trouble. This is just one of many reasons why it's important for pregnant women to see their doctors early and regularly. Somehow, the idea that we were really going to have a baby felt so much more real when I told Bob about my checkup that night. I knew we were on our way.
By 6 weeks, the embryo has developed the intricate life support system that will sustain it over the coming months: the amniotic sac, umbilical cord, and placenta. The amniotic sac is like a fluid-filled bubble in which the baby floats, insulated and protected. Threading through the coiled umbilical cord are 2 arteries and 1 vein. The arteries carry waste from the developing embryo to the placenta. The vein carries nourishment from the placenta to the embryo. Because the embryo is totally dependent upon the mother for nourishment, she needs a well-balanced diet with 300 to 500 more calories a day than usual. During the pregnancy, her baby's needs will be met before her own. So, if she's not getting enough iron or calcium, for example, the baby still takes what it needs, even if it depletes the mother's supply. As a safeguard, many physicians prescribe a daily vitamin supplement. During this second month, the placenta has grown into a thick, disc-shaped collection of cells and blood vessels with 2 sides, one laced with blood vessels serving the baby, the other with blood vessels serving the mother. The 2 systems never mix. The placenta acts as a barrier or shield against some, but not all, infections and toxins. Some harmful agents can pass through to the baby's bloodstream and may cause problems during this critical stage of development. Throughout the entire pregnancy, however, a mother must be cautious about exposure to dangerous viruses and substances. Pregnant women should check with their physicians before taking any medication or drug whatsoever, and they are advised to avoid all alcohol and caffeine during their pregnancy. Women who drink heavily risk having a defective baby. And caffeine constricts the blood vessels, possibly endangering the baby's oxygen supply. Smoking is also potentially harmful. It, too, endangers the baby's oxygen supply, increases the risk of miscarriage, and can cause stillbirth. In addition, smoking mothers are more apt to have low birth weight babies. Low birth weight is associated with increased death rate. As month 2 draws to a close, the developing baby completes its transition from a featureless form to a recognizable human, now called a fetus. The pattern of internal development laid out at conception continues. During the 3rd month, mother and child continue their story of growth and adaptation. Inside the womb, the baby's skin, teeth, nails, and fingerprints are starting to appear. Although the mother cannot yet feel it, the fetus is moving actively within the uterus. Hand waves, smiles, frowns, and even somersaults are practiced and perfected as the nervous system and muscles mature and develop. The mother's uterus is now rising above the pelvic rim. Her intestines are somewhat compressed, and her abdomen gets a bit rounder. But as the month draws to a close, the fatigue that marked the early weeks is beginning to fade, and if she has suffered from nausea, it too is likely to disappear. By the end of the month, the baby is just about 3 inches long and weighs about an ounce. It looks like this. Mother and baby are now ending a critical period in the pregnancy, the period when most spontaneous abortions or miscarriages occur. A spontaneous abortion is nature's way of ending a pregnancy when the pregnancy or the baby is abnormal.
As I entered the 4th month, I started to feel more like my old self again. My energy was returning. And I was excited because, even though I wasn't really showing yet, I started wearing some of my new maternity clothes. I was starting to gain almost a pound a week.
During this month, the baby grows to about 6 or 7 inches in length and weighs about 5 ounces. The number of brain cells increases rapidly. Bone tissue continues to build, and fine, down-like hair called lanugo covers its skin. This hair is gradually shed as the baby grows. During this month, the baby starts practicing many of the survival skills it will need outside its mother's womb. This baby tries to suck as its thumb passes close to its mouth. It's also during this month that the child begins to hear. And it's this 4th month that's especially important to mothers like Jane Johnson, who are over 35. During weeks 14 to 16, many such older mothers have a test known as amniocentesis.
We were told that the risk of Down syndrome is greater for women over 35. Down syndrome babies have physical defects and mental retardation. After talking with our doctor, we decided to have amniocentesis to make sure our baby was okay. We really felt we needed to know. Before the amniocentesis, I had some blood taken for a test which measures alpha-fetoprotein, a substance indicating certain nervous system defects. This is a pretty standard test for all pregnancies. And then I went in for the amniocentesis itself.
In any amniocentesis procedure, the doctors first use ultrasonography to check the position of the placenta and baby. Ultrasound is a technique which creates images using sound waves rather than X-rays. Then, being careful to avoid the baby and placenta, the physician inserts a needle through the abdomen into the amniotic sac and removes a tiny bit of amniotic fluid. By analyzing this fluid, doctors can identify certain genetically linked disorders.
We were fortunate. When our results came back, my doctor assured us that as far as the test could show, our baby was doing fine. We were so relieved.
The 5th and 6th months are an exciting period for the mother and child. About this time, the mother's profile takes a distinctly pregnant look as the uterus pushes upward and out to accommodate the growing baby. Most mothers can now detect the first stirrings of their babies, often called quickening. These faint flutters gradually turn into energetic kicking and turning as the baby grows stronger. This baby is just over 5 months old. Her internal organs are maturing rapidly, yet she weighs only 3/4 of a pound and is about 11 inches long. She's starting to store the iron she will need after birth. And since the baby will draw iron from its mother, many physicians prescribe iron supplements at this time. By the end of the 6th month, the baby is anywhere from 11 to 14 inches long and weighs up to 1.5 pounds. Its skin is covered with a cheesy protective coating called vernix caseosa that may be seen at birth. Mother and child are now entering the last trimester. Inside the mother's uterus, the fetus is maturing and gaining weight rapidly. The baby's lungs are coming closer to the point where survival would be possible if it were born prematurely. The mother is now gaining about 3/4 of a pound a week and may start to tire easily and feel the pressure of the increased weight in her back. As the due date comes closer, many expectant parents get ready for the birth by attending prepared childbirth classes. Their main purpose is to teach the mother certain relaxation techniques that will minimize the need for anesthetics during delivery. Anesthetics are passed to the baby through the placenta and limit its oxygen supply, so the less used the better. These classes are available through hospitals and local health departments. Both fathers and mothers take the class, as fathers play an active role in helping the mother through labor. The most common technique taught is the Lamaze method, given by certified childbirth educators.
At our class, we learned relaxation techniques and exercises that would help us get through labor without using painkillers. Labor pains are actually the muscle contractions of the uterus working to push the baby out. We practice these exercises at class and at home. We also learned what to expect in labor, how we would feel, and how a normal labor progresses. And in case things didn't progress normally, our teacher told us about cesarean deliveries. Sometimes if there are certain problems, perhaps the baby is in the wrong position or its head is too large to fit through the mother's pelvis, doctors will deliver the baby surgically by cesarean section. Our instructor told us about the different pain medications that are available. Even though I was going to try not to use any at all, I was glad to know about them.
The last month feels the longest for many mothers. The fatigue of the early months returns. The baby is now pressing up on the mother's diaphragm, making breathing more difficult, and pressing down on the mother's bladder. Over the course of this month, her baby will grow to an average length of 20 inches and weigh about 7½ pounds, although any weight above 5 pounds is considered normal. About a week or two before delivery, the uterus may noticeably lower. As the baby positions itself for birth, it descends slightly into the pelvic cavity. This is called lightening or dropping. Toward the end of the month, many women experience a rush of energy and an urge to clean and put things in order. This behavior, called the nesting instinct, often signals that birth is near.
Our baby was ready. I went into labor early one morning. We followed what our instructor had said about timing the contractions. Bob helped me to do my breathing, and I used the massage techniques we had learned as the contractions became stronger and more frequent. After a few hours, the contractions were 5 minutes apart. We knew it was time to go.
No two labors are exactly alike. The length and strength of the uterine contractions will vary from woman to woman. But all normal labors follow the same sequence and are divided into the same 3 stages. This is how the baby is positioned before labor begins. Its head has descended slightly into the mother's pelvis, and its skull bones, which haven't yet grown together, start to glide over each other to fit the narrow passage. This is how the baby is positioned at the beginning of the first stage of labor. During the first stage, the cervix begins to thin out and open up to allow the baby to move out of the uterus. The first stage is the longest. The second stage starts when the cervix is completely open and ends when the baby is born. At this stage, the head is deep in the birth canal. The amniotic membranes have released the amniotic fluid. Now, the crown of the baby's head is seen at the outlet of the vagina. The uterus and the mother's voluntary pushing are helping the baby out into the world. After the head emerges, it turns to the side as the shoulders are rotated. Soon, and often very swiftly, the rest of the body slides out and the baby is born. After the baby is delivered, the mother enters the third stage of labor. Its function is to expel the placenta, sometimes called the afterbirth.
Right after the delivery, we got to hold our new son. I think at that moment we first started to feel like a real family. It was a new beginning for us. There he was, a brand new person, and still a part of us.